Elisa Moore. And there we go. We're recording now. Good morning, everybody. My name is Elisa Moore, and I'm the co-host for today's webinar. I'm working with strategies out of the Child Abuse Prevention Center in Sacramento. And you'll meet my co-partner momentarily, Sarah LaCroix, out of All for Kids in LA. So welcome to today's webinar, Taking a More Holistic Approach to Community Pathways, Insights Gained from Collaboration to Drive Innovation. Before we start our webinar this morning, we want to acknowledge that recent federal policies may be causing fear and uncertainty for the marginalized communities that many of us serve. We remain committed to supporting efforts that ensure the safety and well-being of all children and families in their communities.
Thank you, Lisa. Good morning, everyone. My name is Sarah LaCroix, and I'm also with Strategies TA and the Los Angeles County Child Abuse Prevention Councils. I'm very happy to be here, especially on this LA County specific webinar to talk and hear from all the great folks who've been making community pathways happen in LA County. So if we can go to the next slide. Awesome, thank you. So we'll ask, we will likely be a pretty good sized group here today. So if you can please introduce yourself, you're encouraged to do that in the chat. Please include your name, organization, role if you would like, your tribe and or county. That'll just help folks here to get to know you a little bit better. So please take a moment to do that. I'll keep on, I would say for folks, take a minute to continue doing that. And once you finish introducing yourself in the chat, we'd like to find out who is in the room today. So if you can please use your phones, you're able to take a picture of the QR code here. And I believe the team is also going to put a link in the chat. And place a pin on the county you support or work. Oh, thank you. I see the team just put it in. It's a Mentimeter link.
Can you put up the link again?
There it is. Yes, I'm sure we can. I think they just dropped it in again. I know it's hard with the cascading introductions too. Nathaniel, can we zoom in a little bit on the map? Is that possible? We folks can kind of see, looks like we've got some LA counties. I think that's San Bernardino folks are here. To Larry. Welcome. Nancy, hi, welcome. One of our planning team members for the statewide convening is here. All right, great. So you start to get a little bit of a feel. Oh, there we go. More Northern California, San Diego. Welcome, folks. Ventura. Lovely. Thanks, everyone. Nathaniel, does it seem like most are in?
On the bottom of the Mentimeter, you see there's 28 or 29 responses coming in.
There's a few more, a few more. Great. Well, we'll continue to collect those as they come in. I don't want to take too much time. I think you get the idea that we have a pretty good representation, a lot from central and that sort of central north area, a few northern counties, definitely a good representation from the Southern California folks. So thank you all for being here. We'll go to the next slide, please. That is our little housekeeping. right. So before we begin today, just for folks to be aware, it will be recorded. We do have ASL interpretation and closed captioning today. So if that is something that helps to support you in accessing the information today, please feel free to pin that person, pin the ASL interpreter, and we can definitely support you on the tech side if you need any help with that. It will be recorded. For any tech issues, please reach out to any of the Strategies TA team that is here. That would be Serena Chow or Nathaniel Ruiz. Follow-up email will be sent to all participants that will include all the materials from the webinar, so no worries, you will get everything that you see today via email. The PowerPoint will be shared in the chat, and we do ask for folks to please complete the survey at the end of the webinar. That really does help us learn from your experiences and figure out how best to make these webinars useful and helpful for you in the future. Now pass back to my colleague, Elisa.
Thank you, Sarah. We'll go on to the next slide, please. Thank you. So who is Strategies TA? We're a technical assistance offering statewide program co-led by both the Child Abuse Prevention Center and All for Kids. Strategies TA is funded by the California Department of Social Services, Office of Child Abuse Prevention. Strategies TA aims to elevate and strengthen California counties' capacity for planning and implementing coordinated systems, evidence-based programs, and strategies to prevent child abuse and neglect. Next slide, please. All right. So we're going to start today with our Los Angeles County Community Pathway conversation. And so I'd like to introduce you to our first speaker, Dr. Jacquelyn McCroskey. Dr. McCroskey works in philanthropic, government, and private sector partners to harness the scientific potential of linked administrative data to inform policy and practice to support child and family well-being. She currently serves on the Los Angeles County Commission for Children and Families, the Policy Roundtable for Child Care and Development, and First Five Los Angeles. She's a member of the Child Welfare Council's Prevention and Early Intervention Committee and co-chair of the Community Pathway Advisory Subcommittee. Welcome, Dr. McCroskey.
Thank you. So I'm really happy to be here to share a kind of an overview of the background for the work that we've been doing in LA around Community Pathway. And I think I have a slide deck that's going to be coming up pretty soon. There's also a full report. So I'm basically today giving you a teaser, a précis, if you will, for this work, but there's a report which will be in the chat as well. I know it's these slides. Should I be able to see them?
They're coming up now.
Fabulous. Thank you. Can we go to the next one, please?
I think some tech issues on the back end. Sorry about that.
Okay.
Here they come up again.
Okay. I can go ahead and get started, and then we'll catch up with the slides. So back in 2020, 21, 22, the potential for Community Pathway looked like almost a dream that some pieces of it could be coming true now. And what we decided to do in Los Angeles was to use the opportunity of Community Pathway to test ideas, to develop new partnerships, and to really focus in on building on what was already in place in Los Angeles County. So this gives you the Nathaniel, you're going too fast. All right, let's go ahead a couple of slides. Keep going. Keep going. Next one. Thank you. So Community Pathway, as you know, there were opportunities for each county to say what it wanted to focus on, if it wanted to focus on Community Pathway, and the same at the state level. In our state prevention plan, We define community pathway very broadly as any avenue families can use to access the continuum of services outside of the traditional child welfare service delivery context. And you'll see from LA's point of view, we also wanted to emphasize that we wanted to help families access culturally derived, appropriate, relevant, and responsive services built for them in their communities and delivered by organizations and partners that they already know and trust. So I would say Los Angeles County very enthusiastically embraced this opportunity, in part because we love the idea of building on what we have. We've been working on prevention efforts for literally decades here in Los Angeles County. So we thought we could pull together some of these key partners and pieces and get a jump start on this. And we started in the summer of 2022. Next slide, please. LA is I'm sure all of you know, but those of us in LA learn more about every single day, is very big, very widespread, and very different in different communities. And so we had to think about regional differences. We had to think about key partners who were already involved in prevention work, as well as those who really weren't. And so what happened was that our Department of Children, Family Services, and Probation, pretty much at the same time that they were focusing on beginning implementation of FFPS for the Title IV agencies, asked some key partners to lead development of community pathway. And those partners included our County Office of Child Protection, our Department of Public Health, First 5 LA, and the Commission for Children and Families, along with community members with lived expertise and leaders, tribal, CBO, and institutional leaders. I think that was 2022 where we started. We now have an advisory committee with more than 100 participants and lots of other both county departments and local institutions who have signed on. Next slide, please. I want to give a shout out to the Prevention Early Intervention Committee of the Child Welfare Council. As you heard, I'm a member of that committee, but I don't want to give them a shout out just for that. It was that a moment in time when the state had not yet been able to say much about a framework or guidelines. And so the PEI committee stepped up and said, let us start thinking about what should be the key building blocks for this effort across the state. These recommendations were part of one of the initial report that PEI did, and it was unanimously approved by the Child Welfare Council in 2023, with a strong statement from Secretary Galley that he really wanted to see continuing partnership and work together to guide the development of community pathways over time. There were two other reports, one on financing and the other on mandated supporting, all of which were very, very helpful for us in Los Angeles County to try to feel like we were aligning our efforts with where it seemed like the state work might go. Next slide, please. And so LA County's approach certainly takes into account the state approach, but we really wanted to focus on building on the systems of services and supports already in place in communities across our county. We wanted to, as I mentioned before, pilot test some new things and see if the partnerships, more partnerships, different kinds of partnerships, how they could be most effective. So we were really grounding our efforts not in standing back and saying, let's create a new program necessarily, but saying, how do we work together more effectively to maximize what's already in place? And essentially what we've done is 27 pilot tests, some of which are completed and some of which are still underway. And we are building on, we're really fortunate because we've had a lot of collaborative work around prevention in LA County for decades, really, since the 1980s, so really decades. And we're really able to build on that work. Next slide, please. So what we did was we basically addressed 4 strategies. So if you've got, I'm really talking about utilization now of the state block grant funds and the TA funds. How do we spend those limited resources most effectively and efficiently? The strategies were, number one, to strengthen public-private partnerships and build the capacity of our community-based organizations. This slide lays out some examples of pilot tests under each of these strategies. I'm not going to tell you about the ones that are in bold because you're going to be lucky and hear about them from the people who really created them in just a few minutes. The second strategy was to establish institutional partnerships to build support for key populations. So we definitely wanted to build on what was in place, but we also could see that there were key populations for whom we probably didn't have the partnerships and the infrastructure we needed to move forward. And just an example of that is some work that we've done with social workers and counselors at LA Unified School District who work with the early childhood programs. We're very fortunate to have an established home visiting system in LA County with a good deal of infrastructure. And we want to introduce those social workers and counselors to that infrastructure and to an e-directory, which is in place, which enables you to search available program slots in your part of the county. We've also done some really wonderful work with plans of safe care with the hospitals. It's not that work hadn't already been going on, supporting hospitals working with families affected by substance use disorder and their babies, but rather trying to tie community-based supports to that work. So our plans of safe care work has really been introducing navigators from community-based organizations to support medical personnel and not add hugely to their already very demanding workload. Next slide, please. And the third strategy had to do with bolstering existing promising initiatives. There are a lot of things that get started and then they lose momentum or we forget about them or the next thing comes along. And we felt like we had a number of things already underway that were really important building blocks for what Community Pathway could be. You're going to hear about mandated supporting initiative in a few minutes, so I'm going to skip to the next one. The fourth strategy was enhancing community-based services and supports for families involved with DCFS. So even though Community Pathway is largely focused on families who are not yet in touch with DCFS, we all know that families touched our child protective services system at different points in time. Some never touched, some touched multiple times, some touched once. And so we really wanted to think about building the community pathway for families who had never been involved with the protective services system, for those who had some involvement perhaps in the past, as well as for those who were coming out of, hopefully getting ready to be able to resume their family life without the child protective services system. I'll just give you one example of this because it's one of my favorite projects, and that is what we call the Mentorship Demonstration Project. And this is where some young women with lived expertise developed a mentoring program for young people in a transitional shelter care facility. They developed the curriculum, the training, the mentorship approach. They tracked and evaluated the program. There is a report on that particular program, but one of my favorite quotes from that report is from the young women who developed and operated the program. They said, we went in expecting to work with some young people who had complex needs, and we ended up meeting some young people who looked a lot like we did when we were their age. So you can imagine the impact of both ways for both sides in terms of seeing yourself when you were young and seeing an older person who could be your mentor. Next slide, please. So the part I wanted to spend, or I was going to say spend most time on, but really give you an overview of was our achievements, challenges, and lessons learned. So in terms of achievements, in 2.5 years, we set up 27 pilot tests. We we're able to kickstart this nearly simultaneously, as I mentioned before, with the development of our county's Title IV strategy. And that was because DCFS and probation trusted other people to help them lead the community pathway piece. So our working group has very much been people inside county government and people outside county government working together. The other thing I think which helped us really accelerate efforts was we really could build on the existing infrastructure around our countywide home visiting system. So our countywide home visiting system leaders, I would say, are the Department of Public Health, First 5 LA, and LA Best Babies Network, which is the entity that was put together to support this system. And it does a lot of really wonderful work around training, fidelity tracking, new program development, data, et cetera. So we had some really strong partners around home visiting, and many of these pilot tests are connected to home visiting. We had some established relationships and new relationships, and I would say a lot of the new relationships had to do with starting by thinking about the multiple needs of families with young children and who maybe hasn't been included in our work on partnerships. So I would single out our early childhood education partners who have been at the table to a certain extent, but we thought that we could strengthen that relationship. And there are a number of others where we're really sort of forging a different kind of relationship to help us move forward. Next slide, please. Another achievement has to do with the fact that our county government is very big. It's the largest employer in the county of Los Angeles. It is extremely bureaucratic, and moving something quickly is a big challenge. So we were able to achieve some pretty quick flexibility in financial management and contracting that we weren't sure we knew how to make happen at the beginning, but our partners stepped up in a big way. So for example, some of these pilot projects happen through subcontracts with existing contractors because getting a new contract underway is a very time-consuming business, and subcontracts can be quicker. We also did a number of interdepartmental transfers across county departments, and we relied on philanthropy, including our county has a Center for Strategic Partnerships, and those strategic partnerships are with philanthropy that's interested in supporting county government efforts. And our Southern California Grantmakers Association works with the Center for Strategic Partnerships, and they've both been super helpful. The other thing that really helped in terms of the fiscal side of things is we were able to develop very strong relationships between the fiscal people at DCFS, Department of Public Health, and First 5 LA. Sort of think through the potential for sharing resources, for reallocating resources, for filling in gaps, et cetera. I would say another achievement had to do with aligning with existing initiatives. We're a big county. We have a lot of initiatives, and this just gives you a sense of some of the ones that are also included in this effort. Next page, please. And we were able to spend some time focusing on systems change, not just on the pilot tests, but all of us know for sure how many system change efforts were already underway, and even more underway now at the federal level. But at the state level, we had many initiatives already underway, and in the county, we had many initiatives already underway. So how do we align those? How do we make sure that the people who are talking about one of them are also in touch with the people who are talking about another one? So we don't continue our silos, but we're sharing across those systems in order to make a whole. And the other thing about system change, I would say, was we were very, very interested in, we knew LA was stepping out in front. And we were very interested in trying to understand and keep track of decision making at the state level, so we didn't head off in a direction that we later found to be problematic. Next slide, please. All right, challenges. I definitely have to say that fiscal sustainability and our planning for fiscal sustainability is only partway in place. And to some extent, that's because it's still underway at the state level. It's still underway amongst many of our partners at the local level. A lot of, as you know, a lot of even more challenges in that direction now, given what's going on. But there are also some key issues that counties need to have direction from the state from, and one of them certainly has to do with a reasonable definition of payer of last resort, and with claiming and processing. Yeah, how are we actually going to make this work administratively? Another challenge is that, well, as you well know, I'm sure all of you, well, FFPS focuses on evidence-based programs. The most urgent issues for our families are basic supports, resources like housing and childcare. And we knew that before, but after the last few weeks, we know that even more directly based on the wildfires in Los Angeles County and the many, many, many families who are in desperate need of basic supports. The next slide, please. Another set of challenges has to do with how do we build effective bridges across systems? Because we know so many families work with multiple systems at the same time or over time, and we know our systems are very big and very siloed. So what are the ways and how can we develop partnerships and relationships that really do focus on building those bridges? And at the same time, how do we strengthen and sustain the community-based the community-based programs that families always say they trust most? There's huge challenges in terms of county contracting, barriers in the current contracting processes, but the underlying issue, not just for this, but for so many other things, to support our populations more effectively, is that it's a great deal more difficult for those culturally relevant, locally based, smaller agencies that families trust to contract with the county than it is for the very large agencies that have a great deal more resource and contracting experience. Next slide, please. I don't think this is my favorite challenge, but I'm a data person, so I really want to make sure that we talked about this. There's some data collection plan for Community Pathway, but there's a lot of important questions which we really haven't formulated yet or thought about how we could possibly get the data that could answer some of those questions. The big questions for us in LA right now are about the capacity and gaps in our current service systems, and not just at a county level, but at a regional level, because we have in LA County multiple ways of dividing our territory, but one way is something we call service planning areas. There are 8 service planning areas in our county, and just a few of them will help you understand why this is such a big issue. One of our service planning areas is the Antelope Valley. That's high desert. It is not urban. It's got a number of very unique problems. And we have a Western service planning area, and they've got a whole set of urgent problems right now. We've got South LA. So doing our analysis at the system level is going to be really, really, really important. Putting family goals and priorities first, and how important is person-to-person engagement? I believe that it's of the essence, but a lot of times our answer is let's come up with an electronic answer to this, and some that sometimes leaves behind some families who are much in need. And I just added the last one because I think the issue of how we protect personal identifiable information has been urgent for a long time, but it is even more urgent now. Next slide, please. These are just some overall lessons learned. If you want to take a look at the report, we go into good deal more detail in terms of lessons learned from some of our key pilot projects. I don't think any of these will sound surprising to you. I just want to talk about the effective collaboration takes time one. In one of our previous efforts in Los Angeles County, we used to have a children's planning council, and we used to say you have to go slow to go fast. And what we meant by that was if you don't develop the interpersonal relationships on which partnerships are based, if you jump right to, but what is the program? What is the project? You're inevitably going to lose momentum. So you go slow, even though it seems slow in terms of project development, but you focus on the interpersonal and helping people see what everybody brings to the table and why it's so important that we work together. The relationship building, obviously, and the focus on equity, social justice, and co-creation. But I think the really big lesson is it's not just evidence-based programs. It's resources, opportunities, and supports for our families and children and communities. And next slide. So what we've been doing in LA is co-creating, partnering, and investing to achieve better results for children and families. It doesn't look at this moment as if that's going to be an easy job in the foreseeable future. But it's still an important one, and it's still an urgent one. I was thinking earlier today about Charles Dickens. This is the best of times. This is the worst of times. It's really hard right now to see the best of times in our country and in our county. But the best of what we've been doing is bringing people together, people who are passionate about support for children and families. And that is going to be our future. So I will quit now, and really happy that you get to hear from some of my wonderful colleagues in this process.
Jacquelyn, thank you so much. I couldn't agree more. Like, relationships are key, and collaboration moves at the speed of trust. That's for sure. Well, thank you. And I have the distinct pleasure of introducing our next speaker, Dr. Tamara Hunter. Dr. Hunter is a seasoned leader with over 2 decades of experience improving the lives of vulnerable children and families in Los Angeles County. She's the interim executive director of the Los Angeles County Prevention and Promotion Systems Governing Committee, focused on enhancing the county's prevention and promotion infrastructure through cross-sector collaboration. Dr. Hunter also directs the county's effort to reform mandatory reporting of child abuse and neglect and is a national expert on the topic. Dr. Hunter, welcome.
Thank you so much. It's great to be here with this group. I'll share my screen. And during my time, do you see my screen first before I begin? My slides? Okay, great. Thank you. During my time with this audience, I'm going to talk a little bit about our work to reform mandated reporting of suspected child abuse and neglect in LA County. So given the wave of efforts to reform mandated reporting that's underway throughout the state of California and throughout the nation, I won't spend much time overviewing the myriad reasons that it is such a deeply, deeply flawed policy response to our responsibility as a society to ensure that children are not harmed. This slide touches on some of the most important reasons for reform. It includes the fact that our current approach to mandated reporting has no evidence base that proves that it is actually effective in preventing abuse or neglect, yet there is ample evidence of its harm. Mandated reporting is a policy that is reactive by design. Mandated reporters have been conditioned to believe that they have a binary choice of either reporting or not reporting maltreatment that has already occurred. And as such, we miss critical opportunities to provide supportive resources upstream to families to prevent future maltreatment and to strengthen those families. We've given people, just by nature of where they happen to work, this tremendously consequential responsibility of reporting or not reporting suspected abuse or neglect, and we've failed to prepare them to carry it out responsibly. And as a result, mandated reporters feel, and they are in fact actually ill-equipped or prepared to carry out this duty. And this results in, a number of consequences, including the fact that just a fraction of the reports that they make turn out to be actual abuse or neglect after they've been investigated. We know that the decision to report or not report is influenced by so many other factors that can be altogether distinct from actual concern about abuse or neglect. So we have this inadequate training and support for mandated reporters, coupled with the many factors that influence reporting decisions. And this all results in over-reporting of children and families who do not need the child welfare system, who can have their needs safely met in community. And it also leads to underreporting of children who may truly be unsafe. And this over-reporting in particular matters so much because it can have a chilling effect on help-seeking behavior. And it really chips away at those protective factors that have been found to be so critically important to keeping kids safe. When families are afraid to seek help, when they're afraid to ask for help of the organizations that they should be able to turn to when they need it, they go underground, and this makes children less safe. Another really important factor to lift up is that involvement with the child welfare system in this country is without a doubt a manifestation of the criminalization of poverty. Mandated reporting in many ways is the point at which society's isms, if you will, racism, classism, paternalism, formally intersect with the child welfare system. And as such, it is a driver of racial disproportionality in the child welfare system. And the final reason that I'll lift up that we must reform mandated reporting is because we have created a system that pits the best interest of mandated reporters and their organizations against the best interests of the families that they serve. So LA County has been working to reform mandated reporting for a couple of years now, and we're doing so through a really broad coalition of amazing leaders and change agents who are committed to being a part of the solution. And our goals in LA County are our goals of this reform effort is to transform into a model that prevents children from experiencing harm. That is harm that's caused by child abuse and neglect, as well as the harm that is caused by involvement with the child welfare system whenever it is safely possible to do so. And we know that the best way to ensure that children are safe is to ensure that their families are healthy and well in the broadest sense of those terms. And so the other goal of this effort is to do a better job of providing high quality, supportive services to families who are in need but who don't need CPS to prevent future maltreatment at the mandated reporter level. And the final goal of our work in LA County is to eliminate mandated reporting as a driver of racial disproportionality in the child welfare system. And we believe that we've developed a model that will help us achieve these goals. And so our model for transformation involves improving the training that mandated reporters receive, and most importantly, improving the quality of decisions that they make through the use of decision support processes and tools. Our model also involves building pathways for mandated reporters to easily connect to the community pathway for those families who need supportive resources. Our work also involves organizational policy reform and legislative advocacy. It's another really critical pillar of our work. And finally, narrative change undergirds everything that we are doing. And at the core, the work that's underway in LA County is truly a narrative change effort. I like to describe narratives as within this context, as the stories that are told, the stories that are heard, and the stories that are believed about a social issue and about those who are impacted by it, and what is possible in terms of resolution. And so the narratives to which we subscribe about families and about communities often serve to hold social problems in place. And this is no different with mandated reporting. One of the most important narratives that we are striving to disrupt in our reform effort is this belief that what we're currently doing, this current policy and practice of mandated reporting, inclusive of all its harms, is somehow a necessary evil to keep children safe, right? So we believe that we have to keep doing what we're doing in this way or children will be unsafe. And that is a fallacy. And in fact, there is a better way. Excuse me. Another really important shift in mental models that we are striving to achieve with our reform effort has to do with the way that mandated reporters have been conditioned to believe that they only have two choices, that they either report or they do not report suspected abuse or neglect that has already occurred. In LA County, we surveyed more than 2,000 mandated reporters. And of those who acknowledged or who admitted that they have made reports when they did not truly suspect abuse or neglect, 65% of them indicated that making a report to the Child Protection Hotline is the best way to get help for families in need. That obviously is incredibly problematic. Mandated reporters need to recognize that a third option does, in fact, exist. And actualizing this third option of connecting families to supportive resources in their communities when they don't need child protective services requires organizational readiness for this transformation. In LA County, we are piloting our model of mandated reporting reform with a few organizations, and we're continuing to learn in the process. We are learning about what it truly takes to move from mandated reporting to community supporting. And certainly the shift in mental models is critically important, but we've also identified other learnings. We have found that although organizations may be very familiar with and well-versed in assessing family needs and capacity building, they don't connect these processes to mandated reporting because we've been conditioned to simply report or not report. A school counselor once told me that he had never considered service linkage within the context of mandated reporting because it's not packaged that way in the training. So in the next few slides, I will share some of the learnings from our work on organizational readiness for transformation from mandated reporting to community supporting. The first and most important step in organizational readiness for this shift is understanding the typical types of concerns that mandated reporters, right, your staff, have about families that lead them to believe that a report may be required. And once you understand what your staff is seeing that concerns them so deeply, then you can begin identifying supportive resources that may be able to safely address these concerns. And because this work is also about promoting holistic family well-being for us in LA County, it's also important to identify other needs that families may have, as well as opportunities that they may benefit from. And it's important that you do so from the perspective of both your staff, but also the perspective of the families. So organizational readiness in this regard requires engagement with families and the communities that we serve. Once organizations have a keen understanding of the type of issues and needs that's causing concern for their staff and making them believe that a report to the Child Protection Hotline may be necessary, and once organizations are aware of the resources that can address these concerns safely, then organizations can begin assessing the availability of these resources. And so questions that you should be considering as you're shifting from reporting to supporting includes whether or not your organization actually provides those identified resources. And if not, are these resources available in your community? So organizations need to ask themselves, and Dr. McCroskey spoke about this so eloquently, right? Do you have relationships with other organizations in your community? Does your organization have informal or formal partnerships, such as subcontracts or MOUs, with agencies that provide the resources that families need? And when considering the availability of resources, when looking at capacity, it's very important that we ensure that what is available is culturally competent and culturally relevant for the family served. Because if not, then you have a capacity issue. Those services are in the community, but they're not provided in a way that feels safe for families and engaging for families. You have a capacity issue. And so finally, when leaders realize that capacity either within their organization and or within their community is lacking, they should be exploring strategies to build up and bolster the prevention and promotion ecosystem, if you will, of services, supports, and importantly, of opportunities that are going to see children be safe and see families thrive. And the final lesson learned that I want to share is about the importance of building a bridge that will facilitate mandated reporters, your staff's ability to connect families to the resources that are available within your organization and available through your community partners. So there has to be a vehicle that gets mandated reporters, gets that third grade teacher from her classroom to the community pathway. And I think that this is something that we've been overlooking in this reform effort. We've been focused so intently on the mental model shift, and we really need to think about that vehicle, because we cannot expect this third grade teacher, for example, to spend hours surfing the internet, making calls to try to identify supportive resources for families. If we want mandated reporters to exercise this third option, to use this third option of linking families who are in need but who do not need CPS to community-based resources, there has to be a process in place that is as easy as it is to pick up the phone and make a report to a child protection hotline. And so the first consideration when it comes to building bridges that organizations should have is regarding their organizational training, policy, and practice. So organizational leaders may want to ask, does our mandated reporter training, policy, and practice norms speak to the importance of linking families who are in need to supportive resources, whether a report is needed or not? Because there are times when the safety issues are present, but the family still needs help, and you can make a report and connect that family to supportive resources. So leaders should be asking themselves and should be reviewing their training and policy to determine if that link is made. Organizational leaders should also consider whether they have decision support processes in place that will help their staff determine when a report to a hotline is needed, or when a family should be linked to services, or when both are needed. Organizational leaders should also ask themselves, do we have processes in place that will facilitate our employees' ability to link families in need to supportive resources? And do our staff know about this? In one of the organizations that we are piloting with which we're piloting our model, that is something that we learned together. Organizational leaders learned right along with the MSI team that staff really didn't understand or know the referral processes that were available within their organizations. We are piloting our MSI model with 2 school districts, and they are using their counseling and case management staff to serve as in-house service navigators, and they've developed policy and practice guidelines to support this. Another of our pilot sites is training their staff to use a combination of in-house resources as well as an online resource portal that we developed in LA County that's called the Family Resource Finder. The next thing I want to lift up is the importance of organizations having a concrete plan to sort of maintain their catalog of supportive resources to ensure that the information is always up to date and always accurate. Many of you may know that doing this is no small feat. Accomplishing this is no small feat, and it truly requires an organization to dedicate infrastructure to keep this information current. And finally, and again, Dr. McCroskey lifted this up, organizations must consider the best practices and best strategies for engaging families in supportive resources. Of course, wherever possible, this means providing a warm handoff. That's always a best practice. In some of our pilot sites, we have provided staff with some light coaching to help them sort of take off their mandated reporter hat at this stage when it's time to link a family to supportive resources. So to take off that hat of mandated reporter and really just focus on the humanity of providing assistance and support to someone in need. So I'll close with sharing a little bit about how you can find some of the tools that we've developed in LA County. If you are in the state of California, we invite you to visit our website, supportingfamilies.lacounty.gov. There you will find our training on a law that went into effect in 2023 that narrowed the definition of general neglect and an associated general neglect decision tree. If you're in LA County, you can access our family resource finder at this website as well. We also have an organizational readiness checklist that includes some of what I spoke to in the previous slides that can be downloaded for organizational use. So again, you can access this information at supportingfamilies.lacounty.gov. Thank you.
Dr. Hunter, thank you so much for that wonderful presentation. I imagine there'll be some good questions in our Q&A portion. And thanks so much. So I'm excited to introduce our panelists for today, which will include Dr. McCroskey and Dr. Hunter, as well as Jose Ramos from the Child Care Resource Center and Deborah Davies, from El Nido Family Center. Just a little background on both, who I've known for many years, and super appreciative of you both being here. Deborah has worked within the nonprofit sector for over 3 decades to promote children and family well-being, family support efforts, and prevention of child abuse and neglect in LA County. Among other efforts, Deborah serves as the convener for the longstanding Council for Family Well-Being for Service Planning Area 2, SPA 2, and a joint collaborative, which includes the SPA 2 DCFS Regional Community Alliance, the Prevention and Aftercare Network, and over 50 other community-based organizations, LA County departments, and community residents. So welcome, Deborah. I'm also excited to introduce Jose Ramos, who is the Chief Program Officer at the Child Care Resource Center, or CCRC, bringing extensive experience in the prevention and child and family well-being field. Prior to joining CCRC in 2022, Jose was the Senior Director of the Prevention Department at All for Kids, which was formerly the Children's Bureau of Southern California, where he led 20 programs that were serving over 10,000 children. Jose holds an MBA and a Master's in Social Work and serves on multiple boards, including the National Association of Social Workers, Family Resource Centers, and Value Charter Schools. So welcome, everyone. I'm going to pass to my colleague, Elisa, for our first panel question. Take it away.
Thank you. So I'd like to start by asking Jose and Deborah how you've prioritized racial equity in the design process of the community pathways at a program level. And for Dr. Hunter and Dr. McCroskey, how have you done that at a systems level?
So who do you want to go first?
How about you, Jose? And then we'll move on to Deborah.
Okay. Good morning, everybody. Again, really quickly, Jose Ramos, pronouns are he and him. I'm an immigrant to this country from South America. So I'm glad to be here and share a little bit about our services. So CCRC, just want to give you a really quick context of who CCRC is. We are a nonprofit organization that started around 1975. Our focus really has been in the past 20, 30 years on offering subsidized childcare services to the community. We currently serve the San Fernando Valley and also the Antelope Valley. Together, we serve about 75,000 children on a daily basis through our subsidized care program. And if you know a little bit about it, it includes from stages. They have stages, stage 1, 2, and 3, an alternative program. So when we were looking at the pilot that Dr. McCroskey and our CEO, Michael Olnick, looked at, we were really wanted to think about the data, right? So that's the first thing we looked at is from the program perspective is what's the data, who's the community, out there in the Antelope Valley. So our pilot program really focused on the Antelope Valley, Palmdale, Lancaster primarily. And so we wanted to see, we had data from our systems, from our subsidized childcare services, but who was out there, who was taking advantage or who was able to benefit from some of the childcare services we could offer. And so we noticed that primarily were, people of color, community of colors, African Americans, the Latino community. And so when we were looking at, well, who do we want to hire? We wanted to make sure that the folks that we hired identified with the community, whether it's language, whether it's cultural background, whether it's, we definitely wanted to hire folks who lived in the community, who were part of the community, and we were able to hire some, not all, but we were able to hire some. And then when we were looking at our research, because we did a research pilot along with it, we really wanted to make sure that we took into account the different ways that community shares, their experience, right? So it wasn't just one way that we looked at wanting to get experience from the community or their experience, but we wanted to make sure that we looked at all the ways that they looked at. Something that Jacquelyn mentioned earlier is we went from making sure that we did one-on-ones in person, interactions to surveys. So to be able to really look at, what the community would allow us to do. So taking into account. And the last thing I will share is when we looked at our outreach efforts and our engagement efforts, really was with the mindset of, again, who is the community in the Antelope Valley? What do we know about the community from our experiences, from others that we've heard, that we've learned from? And so our strategies in terms of outreach was also based on, the community makeup out in the Antelope Valley.
Well, good morning, everyone. I'm so pleased to be here. And like my friend Jose, before I respond to the question, just a short overview of this project that we have at El Nido Family Centers, the Enhanced Family Navigation Pilot. And this pilot is a service and research project that will contribute to the learning. But I want to, generally, our project provides a specialized MI trained navigation partner for identified children and families to specifically remove barriers and increase success in accessing and utilizing the desired services, resources, activities, and supports. And what is so critical about this is these resources and supports, those are the goals of the family. This is very family centric. It's important to us. Things that we have learned is that families, when families set their own goals, and they tell us what it is that they need to be strong and to thrive, that we need to listen. And so the navigators are there to remove any barriers to those goals that they have. The research questions, the anchor research questions that we will answer during this period of this pilot is, what are the resources, supports, activities, etc., that families are requesting? So to actually track those directly from the families themselves. And to what extent are those resources available? The ones that are requested available in our service planning area in SPA 2, and to what extent are families able to connect and utilize those supports, and if not, why not? And so the navigator's job are to be Sherpa guides to walk alongside families and so forth. In terms of our focus on racial equity, from the very beginning of the conversation with this project, removing barriers is really connected to sometimes language capacity, availability of services, cultural competency of the resources and agencies and institutions that are out there. Our agency has done a lot of work with the Cultural Broker Program and in Los Angeles County with eliminating racial disproportionality and disparity. And so it was really important to us to receive information directly from our community that this took 2 years, by the way, the discussion to develop this project. There were many, many people involved in this. So this aspect of this is really important. Just I forgot to say that El Nido Family Centers is we are 100 years old as of April. And so we've been in Los Angeles County and in our communities that we serve for quite a long time. And so I'll leave it with that, but I just wanted to specifically say that this project has been a long time coming, and it's based on a lot of things that Jacquelyn said earlier, the things that we know about families. And I'll leave it with that. So thank you.
I'd like to invite Dr. McCroskey or Dr. Hunter. Anything you'd like to share?
Sure, I will share. So as you heard during my presentation, addressing racial disproportionality in the child welfare system, the racial disproportionality that impacts Black children and families is one of the priorities in our work to reform mandated reporting of suspected child abuse and neglect. It's a core component of that. And when engaging stakeholders, what we always do is share the data on racial disproportionality, as well as lift up the studies that speak to disparities in reporting that are based on socioeconomic status. For many of our partners, particularly those in educators, this is in education, this is an issue that is familiar. It's something that they've also been grappling with for years. But we believe that this sort of awareness, you know, of the staggering disproportionality when it comes to race is an important first step when engaging stakeholders about the need to reform mandated reporting. When we need to, and we enjoy doing so, we facilitate those courageous conversations about race and about class with stakeholders related to mandated reporting reform. The county's broader, and Dr. McCroskey will be able to speak to this more, but the county's broader work to sort of build and bolster a prevention and promotion ecosystem follows a targeted universalism approach, right? So we focus to improve outcomes for all children and families, and to do so through targeted interventions and strategies that close racial disparities and address inequities in marginalized and under-resourced communities. The leaders of our county's community pathway work have really strived to authentically engage community in a myriad of ways. Dr. McCroskey, I'm not sure if you're going to speak to the Thriving Families work, which is so incredibly meaningful. But the leaders of our county's prevention work have recognized the importance and the value of having community at the table and as authentic and genuine partners. I'll say beyond, some of the county's leaders in prevention and promotion, I'll say that overall, overarching LA County has made significant progress in the way that we partner with community and view the value that they can bring to the work. I will say, in full transparency, that the county still has some work to do in terms of listening to what community has to say about what they need and what they want and acting accordingly. But we are making tremendous progress. And so it's something that I, for one, am really proud of.
It's hard to know even where to start with that. But I think where I want to start is with the data. We've known for such a long time about disproportionality in our child welfare system and in our other systems. And yet it's been very hard to get authentic conversations about what we can do about it. It's much more like we're tracking. Okay, we're tracking. But the potential for real engagement with those communities, particularly our Black and American Indian communities, I think is sort of being realized late, but at least it's being realized now in terms of really genuinely wanting, not just people figureheads, but leaders in those communities to talk with us about what's important for them, what are the barriers to actually being able to access, even want support from somebody else. I will talk about the Thriving Families, Safer Children work just for a minute, because it's been such an eye opener, I think, to the many people who've been involved in it. This is Casey Family Programs plus federal administration plus Annie Casey plus a whole lot of other people, national initiative where LA County, it mostly focuses on states, but LA County was selected as one of the initial jurisdictions. And we started off along a traditional path, and we think the county departments will figure out how to do it all. And we were really, really, really fortunate because we have these fabulous young people with lived expertise. And they said, nope, not if you really want us at the table, not doing it the traditional way. And so for the last 3 years, what we have been doing is asking key community-based organizations in our county to manage money for their residents to determine what's important to them, what should happen in their communities. And the residents come up with the ideas, develop the program plans, evaluate what's going on. And the CBO acts as a support and a facilitator. It's as I say, it's been enormously effective, and we have every time we start out with Thriving Families, Safer Children meetings that were like 12 people, and they're mostly bureaucrats. And now when we have those meetings, we have to rent hotel ballrooms because there's 100 to 200 community members who are in those meetings talking about what's really important in their communities.
That's amazing, right? That's an amazing, I don't even know, sort of issue to have. How do you find a space to hold all the people who are interested and want to be part of the conversation? That's incredible. Yeah, thank you all for sharing that. I mean, one of the things we hear a lot is sort of like in different counties, community pathway design and development, folks are really curious about kind of what was your design process for the pilots that you did, and Jacquelyn, also, as you have experience with the other pilots as well, right? So what was that design process like? How did you do that? We always really want to know kind of more about the nuts and bolts. And Jose or Deborah, I start with you first. Either one.
Okay, so I can share really briefly. So when we were looking at our pilot program, which is called Developmental Care Coordination, and what it does is we outreach to families who were receiving subsidized child care services out of the Antelope Valley, Palmdale, Lancaster. We outreach to them and we asked if they were interested in having a developmental screening of their children, of their child, and the one that we use, there's a few that we used. One was the ASQ. And before we even launched the pilot, one of the things we really wanted to do is we really wanted to learn from the community. We wanted to know, outside of any kind of data, what did the community see about the pilot? What did they feel about the pilot? So we began our process with coming up with 7 questions that we wanted to answer, again, using both data, but also using the community's feedback. So we reached out to those families who opted in to being part of the pilot. We did surveys, we did focus groups with them, we did one-on-ones, but also we reached out to those that who did not opt in into the program. We also wanted to learn from them, how come you didn't opt in, or what was some of the reasons that you can share with us that you did not want to be part of this pilot program? Because I think sometimes we only focus on the families who are part of the pilot, because for the most part, that's who we have access to. But in this case, we really wanted to make an effort and say, well, you know what, let's go and find out from those that didn't want to be part of this pilot. What can they share with us that we want to learn from them? And the third thing we did was we also wanted to get feedback from our staff. So what is about our staff, they learned or they heard from the families or even themselves doing this pilot, what was they wanted to share with us. So our design was really with that mindset, which is the learning from the community, learning from the data, learning from our own internal staff. And then from there, we thought, we could build a sustainable and possibly go to scale with this pilot program. But again, we couldn't do that unless we really knew what the community wanted to share with us from the very beginning on the onset. So that's one of the main things. Of course, we also looked at, the staffing and the salaries and all of that. But that, to me, it's sort of something we do anyways when we design programs. But the one different for this pilot was not only the population that we were looking at, which is in the Antelope Valley, as Jacquelyn mentioned, deserts in terms of resources out there. We knew that we were going to have looking at families who were that represented people of color. And we wanted to learn from them from the onset. So this wasn't at the end, but this was really during the whole process that we wanted to do this. So.
This project started out as a conversation with part of the Community Pathway Work Group, where as an organization that has been around in my work in the child welfare system for so long, it was we were asked if we would be willing to track the children and families who were referred to evidence-based practice programs that had been selected by the state. And so that sounded like a fine idea. However, as we have talked about earlier from our presenters, is families need far more than an evidence-based practice program. We know this to be true. So we took what we know from years of working in prevention in LA County and really said, well, this is an opportunity not only to track that and share that information back, but also to really gather up what is it that families are asking for? What do they feel will make them strong? And how do we have it available? Is it available in our service planning area? Is it available anywhere near for families to be able to access? We know that ease of access and location is such an important predictor of utilization. So this has taken a lot of design to know how many elements that we need to track in order to be informative to our systems. So it's quite a list. I think the information, there's a little couple of slides that were entered into the chat that just describes all the things that we are tracking. So we're taking things that we already know and then going back to community and asking each individual family to give us that information and track how they're able to access it and if it actually exists. So as I said before, it's service. It's very intensive service. We do whatever. It's no wrong door, whatever it takes. Any family that has a minor child, can be part of this process. That was important to us. Another element that was really important to us, because the word prevention is at the top of this, there was some pushback about having families that were already involved in the DCFS system have access to this type of navigation service. it was really important to us that all families, regardless of where they are along the pipeline, they've never come into contact with DCFS, or they have, or they're in the system currently, or they've exited the system, that they have access to the type of navigation services for all the things that make them strong and don't re-enter the system. So we really push for that to be part of this project, this pilot that we're doing. And we will be tracking the success of those families being able to access the resources just like the rest.
In terms of the overview, I would say there was probably a time period before I was involved where DCFS and probation were thinking pretty traditional route for this. We're just honestly very, very fortunate that the key leader at DCFS for this development, his name is Rob Woolrich, thank you, Rob, said, wait, we've got some partners around the county who we already work with, and I think we need to expand this thinking. And that was a really important step. So, for example, the Office of Child Protection, which I mentioned before, had been doing lots of work with our county's home visiting system, with the development of the home visiting system. So, given that 3 of the evidence-based programs are home visiting, they said, wait, let's work with the Department of Public Health on first 5. And they also had been doing a lot of work in plans of safe care. Let's work with. So I think what we did is we sort of got this sort of initial steering group together, was said, wait, let's think through the various systems that families rely on, and let's see if we already have partnerships or connections that we can build on. And let's see where we don't have really substantial partnerships and connections that we could build on. So it was one at a time, sort of project by project, probably set of conversations. I personally have known both Deborah and Jose for a really long time. So it wasn't, and Jose's boss, Michael Nick. So it wasn't hard to say, Mike, childcare is really important in this. What can we do that can bring not just childcare as something you refer families to, but the system more in alignment with each other. And the same with Deborah. Deborah, would you please consider working with me to think about what we could do? And other people on this project did the exact same thing. So it was went from a kind of traditional county bureaucratic process to what are the key systems and where are there important initiatives. And so, for example, for mandated supporting, we knew that was an incredibly important piece of what we were trying to accomplish. So there was also a conversation with Tamara to say, how can we, and that was just the starting point. Obviously, that was not the administrative processes, but I think that starting point of personal conversations. What would you like to do? What could we do? What would work best given the conditions that we know in different parts of the county? And I'm just saying all that because I'm not sure we always highlight those kinds of conversations as we're thinking about design processes.
I'll chime in and share a little bit about the process that we employ with our pilot sites. So once an organization has determined that they are ready to make the shift, that they're ready to transform, one of the first things that we do is partner with leadership to create a design team, if you will. And the design team is usually pretty diverse, inclusive of employees who serve in different functions within the organization and therefore have different perspectives. And we like to meet the organizations where they are, and we partner closely. And some of the things that some of the elements of the design process involve identifying policy that has to be revised or developed to align with the shift, developing a plan for training on our model and coaching, which is very important for adult learners. Our approach to coaching involves identifying and supporting champions within the organization. If necessary, we partner with the agency to explore their capacity to provide services and supports to families. And that can involve organizational and community asset mapping and establishing partnerships if necessary. We work with organizations to help develop workflows and referral processes from their staff that are mandated reporters to the services and supports for families. And then we also develop a data collection strategy that both feels right for the organization, doesn't feel like too much of a lift for the organization, and will adequately tell the story of the pilot. And we remain in close partnership with regular check-ins and continue to evolve as we need to.
Thanks so much, Dr. Hunter, and everyone. This is such a great conversation. We're running out of time, but we want to ask one last question and probably direct it to Jose and Deborah to respond to, which is how do you build relationships with your community and families, especially in the light of the history with child welfare? Maybe 2 minutes each, and we'll move on to a Q&A. Thank you.
So because of time, I'm just gonna, I would tell you there's really nothing groundbreaking that I can tell you that you all don't know already, right? The key of it is trust, right? I mean, the bottom line is trust. And then I go back to Jacquelyn's comment. From the research that we did, the families who opted in, the majority of the families who opted in, one of the main reasons they opted in is because we did the outreach in person. Phone calls did not work. Emails did not work. Texts did not work. They said to us, look, because I saw someone, I could ask the questions, I could really connect with that person. Then I opted in. So yes, we have technology and we have cell phones, and I'm not against using it. But at the end of the day, if you're going to build long-lasting, so this is the key for me, long-lasting relationships, it has to be in person, and you have to be able to allow time for it to be trust. However, my big takeaway about how do we build relationships with communities, ask yourself, who are the ones who should be building relationships with? I believe that nonprofit, it is not our business to build long-lasting relationships with communities. It is community with community members that have to do that, right? We come in, we open our doors 8 to 5, whatever the time, they may be on the weekends, but at the end of the night, right, when there's a crisis, whether it's a fire, whether it's an earthquake, whatever it is, the families turn to each other. Yes, they'll come to nonprofits and we'll help them as much as we can. But at the end of the day, it's really, if we're going to invest money, we have to invest in community, building communities, relationships. We can play a crucial role, which is bringing people together and supporting that, building that relationship, whether it's through, a venue, whether it's through food, whatever it is, we can do it. But at the end of it, it has to be them who are building relationship. And the reason why is because even with our pilot, when we looked at parents who said, I thought I had concern or I was worried about my child's developmental delay. So imagine if they could share that with somebody who lives with them or lives in their community. Someone could say, you know what, I also had that experience and this is what I did, right? And those opportunities can happen even more than having someone from a nonprofit come and call you or see you at an event and say, hey, are you interested in doing this assessment or development assessment? So, again, I'm not saying we should ban or get rid of all nonprofits, not at all, but I think we need to realize that if we're going to invest whatever limited resources we may have, it has to be for the communities to build those relationships with each other. We can play a critical role, but it is not with us. It should not be with us that communities are building relationship with. So I'll send it over to my friend, Deborah.
You, Jose.
Thank you, Jose. Well, I couldn't agree more with Jose in terms of social connections being one of the most critical protective factors that we look to build and help support in all of our communities. So I agree with what Jose has shared. I want to talk about it from the perspective of who is community, who is also included in community. One of the ways that we build relationships is to build relationships with each other's in this field. Part of the reason that Spot 2 was chosen um, to to implement these pilot projects is because we happen to have a really strong network of providers and institutions and residents in our service planning area. It has been built over 20 years, and it continues to bring together all from the smallest grassroots entity out there doing this great work to the largest institutions that families and parents, children have to interact with. And those relationships are so critical to our being able to navigate. Don't want to get into politics, but to navigate really insecure and political upheaval times where we're not sure where funding is coming from to help families or if it will sustain. We have to sustain our relationships of all kinds, the kinds we have with our families and with our partners in this good hard work is relationship, it's trust, it's willingness to strategize together, it's willing to have those tough conversations with each other, like what do we do now, how do we sustain beyond a particular funding stream. This time gives us lots of opportunities for innovation when we have the trust of community and we have the trust of our partners and our trust of our institutional partners as well. It's going to take us all to navigate through this particular time in our history. Those bridge building that both Jacquelyn and Tamara talked about, those things are critical to make changes in our child welfare system. So I will leave it with that. I'm very proud to be part of this work and to continue doing this work after 3 decades and to hopefully be able to share some learnings that will continue us down the path of providing safety and thriving families, safe and thriving families.
Thank you so much to all of our panelists. This has just been such an inspiring conversation, and I know people have learned a lot today, so we really appreciate you. At this point, I'll pass it over to Lydia, and I think we're going to try to squeeze in a little bit of Q&A before we wrap our webinar today.
Right. Thank you again to our panelists for your time. We know that this is time that is taken away from the families that you serve. So we appreciate you sharing your expertise to help uplift this wonderful work and helping to inspire other counties who are currently in the same place of planning their community pathways. For those of you who cannot stay for the question and answer portion, this webinar will be recorded and the recording will be sent out. And also just want to remind you all to please fill out the survey. We did put the link in there. But for those of you that can stay and would like to ask questions of our subject matter experts today, we just ask that if you want to ask the question verbally, to raise your hand. We'll pick a few of you to do that. Or if you want to enter stuff into the chat, we can pop a few questions out and lift those up. And unfortunately, we may not have time to answer every single question today, but we can forward those to our presenters to see if there are resources they can share. So we'll go ahead and open that up. So if anyone would like to ask a question. I know there was one back here in the chat that we saw earlier. I think this is for Dr. Hunter. Someone was asking about, let's see, I'm trying to find it. Oh, here we go. Is the Family Resource Finder using specific platforms like Find Help?
Yes, the Family Resource Finder is hosted on the One Degree platform. So One Degree is a platform similar to Find Help. So yes.
Great. All right. And again, if anyone has any questions, you can raise your hand and ask the panel. Okay, we do have a question from Patty Ramirez from Santa Clara County. What trainings did you do to build capacity, especially for collective impact in shifting mental models? So I think this is probably for you, Dr. Hunter.
Yeah, I think this one is for me. The most significant challenge in this mandated reporting reform work is the shifting of the mental models. And for this reason, we've we haven't been able to link to the community-based supportive services piece as quickly as we would have liked, because we have to shift organizational thinking and individual thinking about what is possible, about what it means to keep children safe and to help families thrive and be well. So the work of shifting mental models involves a lot. It involves a lot of conversations, sharing of data. It requires individual mandated reporters and the organizations that employ them to have a degree of psychological safety. They have to feel safe enough to try something different. This policy has everyone gripped by fear. I can't tell you the number of leaders who have come to me and said, we agree with everything that you're saying, but liability, but we're terrified. So the most significant part of this work is loosening that and disrupting this sort of coercive and fear-based mentality. I do want to shout out that we do have some courageous leaders who said immediately, come here, come and partner with our organization. This aligns with our values for families. One of those organizations is CCRC. I hope it's okay to give them a shout out. I try to be discreet about our pilot sites, but I do want to recognize them. So the bulk of this work has to do with the mental model shift. And then after that, after you change, after the narrative change has taken root and people begin to see that there's a different path forward and a viable path forward, the community capacity building piece is not as challenging. It involves conducting needs assessments on the families that you serve, on the communities of which you're a part, and then mapping out the resources that are available within your organization and within your community. That's the easy part. The difficult part is identifying funding to address the gaps. So there are tons of strategies for needs assessments, community asset mapping. The trick is finding the funding to meet the need, to meet the capacity needs.
Great, thank you for sharing that. Someone also asked if you would be willing to share the mandated reporter survey that you presented about.
Yeah, you know what? Let us pull that together. We haven't really shared it out in totality. We usually include it in presentations, but it's something that we can pull together and share out with this group through the organizers of this group.
Great. And again, all materials that were shared today, the slides, will all be included in the follow-up newsletter as well as the recording. All right. Any other questions before we close out?
Michael just put one in the chat.
Okay, Michael, did you want to come off mute to ask your question or?
Sure, yeah, that's fine. Oh yeah, for Jose and Deborah. So Jose as a child care resource and referral and Deborah as a family resource center, how did your kind of program structures set you up to be able to do this work? You know, what strengths were you able to apply from your program already, and then what capacities did you need to build?
So for us, I think one of the strengths is the relationship with the families, right? So as I mentioned, our target group was families who were currently receiving subsidized childcare. And so that could be, we may have had a family who've been with us for a year, to some may be with us for a few years, 5, 6 years. So I think that's one of the strengths, leaning on that relationship. And, they know who we are as well. That's part of, the strength. The other one, in terms of capacity, really, developing the staff to be able to do a developmental screening, right? And how to do it in a way that it's, strength-based, that it's culturally appropriate. That is where we really needed to make sure we focused our energy and our capacity building on staff, that we're doing that.
Yeah, I think that the fact that we are a family resource center, we have multiple sites across Los Angeles, and I think part of the access to those resource centers is so critical. It's based on the old settlement model of people being able to come into an agency or a site that is embedded in their local community that people know about, they tell their friends about. That gives us a leg up on launching any kind of new project. And of course, as Jose said, it's the relationships we have with those families. We know they're more likely to engage with a family resource center than an unknown or than a more traditional institutional partner. So I think our biggest capacity has been just taking this on as a research project as well as service. Doing both things simultaneously is challenging, but I think it's very worthwhile because we do this work all the time. I'm sure most people on this call do, but how much tracking do we do? How much knowledge do we share? And we want the knowledge that we gain from the families to be part of what influences. I think Jacquelyn said this earlier. Influence is where we put our resources as a county.
All right. Well, thank you all for staying, hanging with us for a little bit longer, as our panel shared some additional thoughts and information. I think those are always well appreciated. I wanted us to just be able to close out today by sharing that, we can't do this work alone. And I think that CalPrevents is a wonderful place for folks like yourselves who are doing the work, professionals, to connect, to share best practices, to share resources, and ask questions and receive feedback. So if you're not already linked up with CalPrevents, if you're not already a member, we'll put the link in the chat, and please join us, and hopefully we can connect you all to this wonderful work everyone is doing. Again, I just wanted to say that we are so honored to have Jacquelyn, Dr. McCroskey, Dr. Hunter, Deborah, and Jose join us today to share the amazing, innovative work that they're doing in Los Angeles County. So we're very thankful for them to give us their time and expertise. We also just want to make sure, please fill out the survey today. That will help us improve the webinars that we bring around the community pathway, and we hope to see everyone soon. I also just want to uplift the statewide prevention collaborative convening that we are helping to support. So if you are interested in attending, we can also share that information as well. So also, if you're curious about the work that Strategies TA does, you can find us on LinkedIn, Facebook, Instagram, and we also have a YouTube channel. We will post this webinar on our YouTube channel, but we will also send out the link to the recording as well. So thank you all. Hope you have a wonderful afternoon and keep doing the great work that you're doing. Take care.